There, my name is Alejandro Lopez, and I am going to briefly talk about anaphylactic shock. Quickly, some etiology, pathophysiology, therapeutic management, medications, and patient education objectives. So, what is anaphylactic shock? Anaphylactic shock is an acute, potentially life-threatening immunoglobulin-mediated reaction to a specific antigen. To the right, you'll see a boy with inflammation in the face in response to an allergen, and below is a wheal and flare reaction on the skin. Briefly, some pathophysiology behind anaphylactic shock. What occurs is an allergen will enter the body, and in response, B cells will produce large amounts of antibodies, specifically IgE, which then bind to the mast cells. Now, any subsequent contact with the same allergen will cause the mast cells with the new antibodies to bind to the allergen and cause a degranulation of the cell, therefore releasing inflammatory mediators such as histamine, leukotrienes, and prostaglandins, which then find their way to different target tissues of different target organs and eliciting responses and changes in those systems. That includes skin, cardiovascular system, central nervous system, respiratory, and gastrointestinal. Some common allergens can be food such as peanuts, venom such as honeybee stings, and medications such as antibiotics. Also, some material exposures such as latex. So, diagnosis. How do we know there's an anaphylactic reaction happening? Well, for one, there will be an increased number of tryptase, which is a marker used to determine mast cell activity. Also, the antibody IgE with elevated levels. Skin tests such as skin pricks to determine allergies to different antigens, and challenge testing, which is exposure to different foods and monitoring the reactions. So, some therapeutic management. As a nurse, it's important that you first establish and stabilize an airway. There is also the removal of the allergens. So if there's a bee sting, it's important to remove that. There's also the positioning of the patient, such as recumbent with feet elevated. There's also the medication administration and patient education that follows. So, in response to the medications, there's a first line, which consists of course, opening the airway, whether it's intubation or tracheostomy, as well as O2 administration, so nebulizers or non-rebreathers. There's fluid replacement to ensure that blood volume is maintained, and epinephrine, so the administering of epinephrine to reverse peripheral vasodilation, maintain blood pressure, decrease edema, and increase the force of myocardial contractions. Second line, these ones are not life-saving, so they are used together with first line. They could be corticosteroids, such as hydrocortisone. They help to reverse hypotension and bronchoconstriction. Then you had adjuvants to the second line, so bronchodilators such as salbutamol and ipratropium, glucagon, and histamine blockers. There are potential complications that can result if this anaphylactic shock is prolonged and not addressed. These include myocardial ischemia, hypovolemic shock due to decreased blood volume, dysrhythmias, and hypoxia. So, patient education. It's important that the caregiver, family, and patient are educated on the use of epinephrine, so EpiPens. There's also the education on prevention of exposure to potential allergens, so avoiding peanuts or careful of bee stings. And there is also the advising of wearing and carrying a medical alert identification on patients that have severe allergic reactions to the various allergens that they may be exposed to in everyday life. And that is the end of that presentation. Hope you liked it. Thank you.